Justice for? Yes! Justice for? Yes!
These individuals were struggling to get their uncle some help, and that's something that I can relate to.
Sadly familiar, the case of a man who was fatally shot by police during a mental health crisis, bringing back memories of one woman's uncle and her family's struggle through the health system. She says it needs to have culturally appropriate introductions to mental health for Black, Indigenous, and people of color.
They never really could navigate with ease because there wasn't someone that spoke Punjabi. There wasn't officers or care workers or social workers that followed up in a culturally responsive manner. It was almost as though they were just checking boxes.
Manchar Tor says her uncle had undiagnosed mental health issues. Neighbors would sometimes call police, and health and social services didn't consider their family dynamics. She says poverty and basic needs are priorities for marginalized communities.
Mental health is the bottom of the barrel. And so when you talk about prioritizing that with people of color, you have to create an environment that's conducive to that.
Ijaz Chaudhry's family says they called a non-emergency line for help with their uncle, but police were eventually dispatched to his Mississauga home. Other cases, such as this video showing a Kelowna Mountie dragging a woman through her apartment, have organizations calling for change. In a statement, the Center for Addiction and Mental Health says police should not be the first responders when people are in crisis in the community. Tor says mental health needs to be introduced to racialized communities through early community events. For example, she works closely with Indigenous and Métis communities.
That sense of belonging, that sense of identity comes alongside having these cultural activities. So if you can do both at the same time, then you are having a more honest and conversation.
In Calgary, Crystal Ladares, City News.